Hello everybody, welcome back to Remedy OMM. Today, we're going to go over some board-style questions to practice what we learned in Lecture 2, sympathetics versus parasympathetics. This concept is very straightforward and requires simple memorization. I have 4 questions prepared. I didn't add any fluff that you normally find in COMLEX questions, but I believe these questions will cover the topic thoroughly. With that being said, let's dive right in. Question number 1. A 50-year-old male presents to clinic with complaints of sudden fever and cough with blood-tinged sputum. He has a history of hypertension and a long history of tobacco use. He is tachycardic at 105 beats per minute and febrile at a temperature of 100.9. Physical exam reveals decreased breath sounds and crackles. At what levels should osteopathic treatment be focused towards? Okay, so obviously this guy has a pulmonary issue. Pretty straightforward. We don't need an exact diagnosis here. The question is simply asking which levels correspond to the lungs. And that would be C, T2 to T7. Easy, basic, moving on. Question 2. A 64-year-old female presents with the complaint of abdominal pain associated with nausea and vomiting for the last few hours. She also has eye pain and blurry vision. Her symptoms started while watching a movie at the theater. On physical exam, she has a right eye that is non-reactive to light and an abdomen tender to palpation. Osteopathic structural exam is significant for TART changes from T1 to T4. What is the most likely diagnosis? Okay, so we have a lady coming in for abdominal pain with nausea, vomiting, and some eye pain too. Kind of an interesting combination. Appendicitis, gastroenteritis, okay, could be. Conversion disorder and subarachnoid hemorrhage, probably not. They didn't talk about any headache, and conversion disorder is quite hard to diagnose. And glaucoma could be potential as well. What clues do we have in the stem? TART changes from T1 to T4. Okay, well, we know that those are levels that are quite high up in the body, and they actually correspond to the head and neck. So with that clue, we can determine that this answer is definitely glaucoma. Moving on. Question 3. A 49-year-old female presents with the complaints of numbness and coldness in her feet. History reveals type 1 diabetes that is poorly managed. Labs show a blood glucose of 410 and a hemoglobin A1C of 10.3%. Osteopathic structural examination would most likely reveal TART changes at what levels? They aren't giving us much, but this lady's diabetes and her feet problems. What do our answer choices show us? C1 to C2, well, that doesn't really correlate to anything. T1 to T2, again, that's not a specific set that corresponds to any organ system, so probably not. T1 to T4, head and neck, okay, could be an eye issue given her poor diabetes. And T11 to L2, that's much lower. We're talking about the kidneys now, so that's definitely something affected by diabetes. And S1 to S2 could represent her dermatomes down below, but it's not really a specific set for viscerosomatic changes, so let's cross that out. This is very much a COMLEX style question. 2 answer choices that have potential and not enough information to determine which one is best. In this situation, I think we have a little more faith going with D, as we know that the kidneys do really get screwed with diabetes. And thankfully, we're correct. A 27-year-old medical student comes to your clinic presenting with a sudden onset of feeling of doom. Uh-oh. She states that she has had this feeling a few times before and is associated with an episodic headache and palpitations. Do you smell anxiety? A urinalysis reveals an elevated vanillamandelic acid and metanephrines. Oh wow, big plot twist. Osteopathic structural examination would most likely reveal TART changes at what levels? Okay, so that urinalysis basically seals the deal for us. We obviously have a pheochromocytoma, which, as we know, is a tumor of the adrenal glands. So we are looking for the adrenals here. Too high, too high, too high. Yep, and not a set. So definitely the answer is D, T11 to L2. That's all I have for you guys today. Here's a table to review your levels. It's a very straightforward topic, and with practice, it becomes easier to recognize, so keep practicing. As always, thanks for watching. Please like, comment, and subscribe, and support our channel. We will see you guys in the next lecture.